in one day. The very next day, I got an interview call. Went there with मिश्रा जी.
Yes.
सब पैसा स्क्रीन पे लगा दिए. इंटरनेट लगवा लेते हैं यार.
इंटरनेट तो बहुत यार 100 Mbps का इंटरनेट है, तो अब कितना करेगा उससे आदमी. Hello and welcome. This is Deepak Mishra, and today we have three guests with us. Three guests are Indian doctors who have successfully completed the entire pathway of getting into post-graduation in Germany. They have completed Fachsprachprüfung approbation and now are working as a general surgeon, a radiologist, as an orthopedic surgeon, as trainees. All right. So in this video, we are going to learn from them about their experiences in Germany, what they faced, how they landed up the jobs that they did, how were the exams most importantly, and other experiences, other things that they want to share with us. So watch this video till the end, and I'm sure you will get lots and lots of value through this. When you have more questions, do write us in the comments and we will try our best to get back to you. All right, so our first guest, Nisha. You work as a general surgery resident, right?
Right.
First of all, tell me, how does your work day is? What happens when you go in the morning? What time do you go to the hospital, first of all?
Hello everyone once again. My name is Nisha Tabassum. I'm a first year surgical resident in the first. And for us, on an average daily, we start our rounds like around between 7 to 7:15. So I try and reach around half an hour before the rounds start now, so that we have a clear idea of lab values. We check out if there are new admissions, and we check out the history, lab values, and if there's anything specific that had happened during the night with any specific patient, note file amazing emergency, agar koi ho to. We try and check out everything, and if you're not certain about how to proceed with a couple of patients, then we discuss it with our Oberarzt. Then one Oberarzt is always there at the rounds, so we start like around 7 to 7:15 ke beech mein, and 7:15 we start with the rounds, and it takes like around half an hour to 45 minutes depending on patient load. And then 7:45 around we have got Röntgenbesprechung. So the Diensthabender, the one who had 24-hour shift, those doctors, they go down for this besprechung, for this meeting, and the others proceed to, like, for example, if somebody's posted in OR, then they proceed to the OR now. And if somebody's on the ward, they stay in the ward and they check out, like, if we have any radiological investigations to register, we do that. If there are any consent forms that we're supposed to do, we proceed with that. And if there is, for example, any specific item like preparation for OP or registration, we get onto that. Once we're done with that, and once a week on Tuesdays, we have got HOD rounds as well. So we do prepare for that on Tuesdays. And then we move on to around 8:30 or 9 ke aspas, we move on to our discharges, that we start preparing for the discharges, whatever we have for the day. And then once we're done with the discharges, and then we prepare for the next day now, or next day ke OPs and whatever follow-up we have, we check out the lab values, we prepare them for the next day. And if there is anything that we have to discuss with Oberarzt, we do those things, and we prepare for the next day's discharges that we're supposed to prepare. And in between, once a week, we've got assistant arts. As doctors, we're supposed to, as assistant arts, we're supposed to do the Aufklärung Sprechstunde, like OPD. So when we do once a week, like those are from 9 to 12 o'clock. So we proceed with that, whoever is posted in OPD.
Nice. You are very beautifully have you have put the entire, like, the work that a first year resident does. I mean, obviously you have not talked about much surgeries, that is to be expected, because the first year resident does not do much of surgical things. I mean, but then, yeah, this is very important for our viewers to understand and to know that, okay, what should they expect? Because one should not expect that directly from first month or the first 6 months there'll be a big shot surgery or something like that. That comes much later. So,
Exactly.
okay, this was the perspective from a general surgeon's point of view.
Right.
Now we will ask Shubham to tell us about orthopedic surgery. How is it at your place?
Well, good evening, good afternoon, good morning, wherever what the time is in any part of the world. Well, me and Nisha, we are actually in the same hospital, and we actually do the duties together. I mean, orthopedic and general, there's always an orthopedic surgeon and a general surgeon in the duties. We have 24-hour shift every day. I mean, it's rotating. So the basic day target sub-law, how do you say, or day procedure we have, it's basically the same. We also start at 7 o'clock in the morning. Our visit, our rounds start at 7:15, and but by around 7:45 we are finished with our rounds, and then we have a meeting, which is called Besprechung in German, and we do that. All general surgeons, orthopedic surgeon, vascular surgeon, we have a common meeting because in itself is a common surgical department, and in duties we have to see all these patients. I mean, the residents of orthopedic and general surgery, they see all these surgical patients during their 24-hour shift. So in that in that meeting, we discuss all these cases, depending upon what has happened, what will happen in this meeting. All the things further are decided for this patient. What investigation he's going to get, or what kind of OTs are we going to do in the morning. Today we see the x-rays of the that day operations which are planned. We see the x-rays also. I mean, for example, a knee joint is planned, or a hip joint replacement is planned, or a shoulder replacement, or the fractures, or any like, for example, general surgeries, like any kind of abdominal intestinal obstruction surgeries. We see the CTs also, or any tumor cases, any which we admitted during the night.
So basically, the morning rounds, I mean, the Besprechung that you said, it is about, see, the working hours is still 16 hours. Like that means at 4 o'clock, you're supposed to go home. I hope you guys get free by 4 o'clock or 4:30 maybe. That is supposed to be ideally the case, that, okay, you're supposed to go. And from that time, whatever happens in the hospital till next morning 7 o'clock, that उसका लेखा जोखा जो है वो किया जाता है in that Besprechung, that they do in that Besprechung, that they talk about that, and then they plan for the next day. Yeah, one thing here I would like to inform to the viewers. Sorry, what are you saying?
I'm saying that Besprechung sets the tune for the how our day is going to be. That's the planning, basically, what we're going.
Yes. And that time in this Besprechung, the person who had 24 hours duty, he gets free. Like, he has given everything, he has informed everyone, and now he can go home. So that is the thing. And one thing I would like to inform to our viewers, that the common Besprechung that our colleagues here mentioned, that is not in every hospital. Like, some hospitals, they have different Besprechung for different departments, like where departments are bigger, will take much time. So there, because where I used to work, we used to have initially like this common Besprechung with overlapping Besprechung, but then later on, different hospitals where I worked, they have different, because then each Abteilung, each department is so big that they cannot have a common one, and does not make sense also in that sense. So wonderful.
Exactly.
This way, yeah, please go ahead.
And then after the Besprechung, the Dienst haben the one which who have duty, he goes home, and if I say I'm working on a normal day shift, so after rounds and everything, we start with our discharge letters, and if I'm planning OTs, then I'll be going to OTs, and depending on, I'm having a little bit of experience, so I'm in, like, how do you say, third year, so I get OTs regularly, what to do, small operations, but not big, but I do get.
Okay, nice. That's nice to know.
And also, it's not, depends on the hospital also, like in university. Like in a university hospital, you don't get that much of operations to do on your hand, because there's a lot more hierarchy over there.
True. So many people there waiting that you will, that I have talked in my previous video as well. I talk that very often because I have the experience of like smaller hospital as well, and then I have worked at 2 universities also. So so very, very true. So this way we have the idea about how it is in surgical branch. Now we will move to our third guest, Dinesh. he has managed to land himself a very coveted job that is in a radiology. Now, I'm very interested to know how his path has been and how he has landed. First of all, I would like to know how his days are. We know or we assume that radiologist day is like chill. It's not as like, so I mean, good for you. But certainly, yeah, please tell us about your day and then also about how you managed to get into radiology.
Okay. First of all, hi to everyone whoever is listening or going to listen to it at some point in their life. So, being a radiologist is fun. Compared to these guys, we don't really have to be there at 7 o'clock. We reach at 8. So, woohoo, if we have any intervention going on, which is not every day, which is, say, twice a week. Other than that, we discuss with the chief and one of us will take one of the fields. So somebody will go and take care of CTs, somebody will take care of MRI, somebody doing the intervention, and one person for the conventional radiography. Describing this is not really, the idea is still the same. Somebody from surgical or medicine department will put a request. I will look it up and I will decide whether I want to do the investigation in the same way or do I want to change anything about it. And yeah, we just sit there, look at our screens till 4 o'clock. It's really not really that interesting like these guys. It's not a lot of happening. How I landed this job is the interesting part. So I would go back in my past and I will start from there. The idea of coming to Germany came to me somewhere in 2015. And in end of 16, I moved here, learned some Deutsch up to B2. And right after that, I took the exam in the starting of 2017. Exam itself was not really tough. I took it in Sachsen-Anhalt, prepared for it through whatever the information I could find on internet. There are a lot of forums. I gathered information and data from everybody and just went through, digged in and dived out. Fun part was that once I was there for Fachsprachprüfung, I wasn't really stressed somehow. Was there, and the cause of unknown was driving me into the direction that let's not panic. Let's just sit around and get it through. So I had a case about a person who came in with an ankle fracture, and I had to describe it, take the case history, describe it myself, and I had to also take a phone call, registering some lab values. Took about 20 minutes. By the end of it, 2 surgeons were sitting there. They wanted to discuss the patient with me. That went well also. And people were really cooperative. Nobody was pushing me around. Nobody was making me feel like I do not understand things. And at the same time, in Sachsen-Anhalt, the other states I have heard it has a different viewpoint altogether. Sachsen-Anhalt was not really pushing whether you know a lot medicinally. All they wanted to know whether you can communicate yourself with the patient. So though it was about Fachsprache, it was more about the medicinal vocabulary, how much you have accumulated with you, and whether you can communicate your ideas and you can speak to the patient well enough. As soon as you're done, you get a FSP there. That's how I got that. Once I was done with that, I applied into 11 different hospitals in one day. The very next day, I got an interview call. Went there within a week, and the dude was pretty cool. The chief was really chilled about it. It was in internal medicine. I went in there to work in internal medicine itself, but over time they graduated me into Notaufnahme, so emergency medicine, and they put me into ICU also. And in 6 months, once you have graduated to the idea, the chief and the other residents have seen you that you can intubate, you can resuscitate well, you can do the ventilation, you know your work around. They just leave you be. The better you perform, the more you learn. They just leave you be. There's no pressure coming to you from a senior to outperform somebody else. And if you do not understand somebody, you just move on and ask the next person in charge. People are really helpful. So I spent my most of time during COVID in an ICU, pretty hefty, less hefty compared to India, but pretty hefty. But being a radiologist was a dream that I had held at the back of my head for a longer period of time. So I was continuing my preparation for KP, and for the preparation part, I just kept going on with the surgical residents in the hospital itself. The idea was that the more you practice with the patients, the better you will perform. Instead of going a lot through the books, I just kept going through a lot of cases with the surgical resident, with the neurology resident, and I saw how they work it out. I asked a lot of questions, and by the end of it, you are kind of ready. So I went with a relaxed idea for KP also, and the same went with the KP. I had a cardiac arrest patient for a KP case, went on for history for about 20 minutes, wrote down the case details. Within 10 minutes, they give you about 20. And then there were 3 proofers, so examiners, who were sitting around and shooting you down with a lot of questions, but still not making you panic. It was all really a relaxed environment. I think it also has a lot to do with what kind of mentality you enter the exam. So I made it, and I waited for 15 minutes, and they just came out and said, "Oh yeah, you got it." As soon as I got it, within a week, I applied for radiology positions, and this was the first hospital I came for the interview. And I liked the staff around. After conversating with them for about 2 days, I decided to take up radiology. So that was what previously in 4 years in Dinesh's life.
Dinesh has told us how he has landed a very coveted job in radiology. Most people say that, okay, radiology is very difficult, or dermatology for that matter is very difficult to get in Germany, but he has done it. And we have also heard how he has done it. It is not an easy cakewalk. He had to do the deed. He had to work his way up. He had to pass the exams, first work in internal medicine, do ICU, and then he was in that position to apply for such jobs. And also luck also plays a role. One cannot deny that. And he has, but as I always say, that more you try, the more luckier you become. So he tried for it. That's why the luck also favored him. All right. So with this, people who are in their beginning of their application processes, they just want to know that, okay, can I get radiology? Can I get dermatology? Can I get orthopedics? Yes, nothing is impossible, but you'll have to put the work for that. All right. So with this point, we move to our orthopedic surgeon in house, Shubham. Tell us how has been your journey? What have you done? How have you done it?
I also came to Germany in middle of 2016, and I'm working in orthopedics, so 2017 onwards. But like many people must be knowing, before the approbation, your training period won't be counted. So unfortunately, my training period won't be counted, but experience, of course. So like basic procedure is always the same for everyone. I also gave Fachsprachprüfung, and I gave in Rheinland-Pfalz in Mainz my Fachsprachprüfung, and I learned German till B2 and C1 Medizin German. And in my Fachsprachprüfung, it was also basically divided into 4 parts. One was it's basically the German exam for medicine. So it's like reading, writing, speaking, and hearing. It was divided into like that. In Mainz, it's a very good, very structured exam. And first of all, they give you 40 terminology terms, German to Latin and Latin to German. If in any part you do wrong more than 10, then you fail in that part and you are not allowed to go further. it's like every part. If any part you fail, like hearing, reading, writing, in any part, if the examiners see you that you're not doing well, they won't let you go further in that exam itself. So that you have to do more than 25 or 30 correct out of 40 terminology. And then there are 2 examiners in every state mostly. They can be a surgeon, neurosurgeon, neurologist, anyone from any specialty, they can be there. And my case was about lung cancer, and they basically started, one of the examiner became a patient. He started telling me about his problems and everything, what he's having chronic cough, and he's losing weight and all these kind of things. And you have to ask him, as a doctor, how you're, and the other examiners take points, how you are asking in German. And then whatever history you took, you have to summarize it in your German. And then that same examiner who became a patient now became your consultant, and then you have to present your case to him as a resident doctor. And in that, when you're writing an exam only, you will get a call about your lab values and everything. And in that, they will check you are able to understand what they are trying to say, reports and everything on the telephone call. They just basically want to see that you are understanding German, you are able to hear and communicate what you are trying, basically you don't make any mistakes, because if you understand different and what is being communicated, it could be a matter of life and death in the hospital. So they don't want that.
True.
So that's the part, that's the main, they don't judge your knowledge in that exam. For knowledge, there is Kenntnisprüfung, Approbation, or Gleichwertigkeitsprüfung, any name you can say it. And in that exam, they will judge you in every part of thing that you, that exam was also in Mainz, and it was not an easy exam, I would say. And for me, I took preparation in FIA. It's called Freiburg International Academy for that exam. It was a 3-month course I did. And luckily I prepared quite good. And so I passed it. Now I'm working as an orthopedic since 2019 again in the orthopedics department.
Wonderful. That's very nice. So, so that is very interesting. Our different states, they have slight changes in their pattern and everything, but more or less it is a language exam. How you understand how the parts are, like we are going to have a webinar on that on coming Sunday, where now you guys must be knowing that we have live training sessions and coaching, like online courses and everything. So there also I may say the same thing, that the FSP is not about your knowledge, even though I focus on knowledge, because if you're going to work as a doctor, you cannot just say that, okay, my language is okay, that please take me and I'm going to work, because your knowledge also has to be okay. That is for given. Like that is assumed that you're a doctor, you know certain things. Okay, you cannot say that, okay, this is a language exam. Why do you ask me about the causes of heart attack, like the risk factors of heart attack? You're a doctor, you're supposed to know the risk factors for heart attack, right? So but more or less in all states, the concept is the same, that communication between the patient and the doctor and the doctor, and you have to understand what is written. Yeah, please go ahead. Shubham, yes,
one point I would like to make, of course, it's not a knowledge-based exam. Examiner with your examiner or your proofer will try to communicate with you, because he will try to make a conversation with you, and he will try to, he's not judging your knowledge, but he's trying to make a communication discussing the case. In that case, you might have an impression that he's judging me on my knowledge, but no, he's not judging your knowledge. He's trying to make a conversation as a doctor so that you can communicate with him. Do you know the terms? Okay. Or what do you think are the causes of appendicitis? And you went, of course, you won't say hernia as a cause of appendicitis. You cannot say like that.
yeah, exactly. That is what I'm saying.
Of course, you can say it be some infection and Sundung. He's trying to judge, are you able to communicate like a doctor in an...
True. Good. So now we come to our third guest. You have, Nisha, you work in general surgery, right?
Right.
Can you tell me about your experience? How long have you been in Germany, and how do you feel like after? Have you worked before this in India, or was this your first job? Did you have work experience before this? So you're a complete fresher, right, out of college internship.
No, exactly.
Okay, okay. So please tell me something
Completely.
about.
I finished my internship in India and college.
Yeah, please go
I'm
ahead.
sorry, you were saying something.
I was saying, please go ahead.
Okay, so exactly, I had done my medical studies and internship in India from Gwalior, and then after my studies, I had gone back and I started with German language. Initially, I started with the normal B1 tak. I had done it online. Then I ended up coming to Germany in 2019 September. And then I moved on with B2 German language, and I was in Freiburg. I did my Fachsprach B2 level till December in 2020 January. So I started with Fachsprach course and everything. So firstly, I did my Fachsprach, and then I did my KP course. And I got my FSP termin in 2020 August. It was. And in Freiburg, in Baden-Württemberg, in total, and especially in Freiburg, we have got like 3 subcategories. Firstly, you go and you do anamnese, that is history taking. And there it is time limited. It's like only 20 minutes, and it depends on how you take it, because during the exam, although we had like intensive practice for 5 months, and we had done a lot of also Prüfungsstimulationen, like demo Prüfungs, demo exams, we had a lot of them, but still in the exam, I ended up not taking the complete history. I missed a couple of points because the time was up. But one thing I think that that was positive, or that worked in my favor, was that I did not interrupt the patient. And I let the patient or the person who was pretending to be the patient, I let her complete her sentences, because it actually ended up being a psychosomatische Erkrankung. It wasn't like a Knochenbruch or fracture or normal thing. It was more mentally related. So it was kind of good that I did not interrupt. Although I missed the end part, Noxin and alcohol history and all those things, I ended up missing. I did not complete that history. Then moving on to the second part, it was again a 20-minute time limit documentation, which is you write about whatever history you have taken, and that is again 20 minutes you do. And then it is a third part is Arztgespräch, which is the entire commission sits together, and you have one consultant. He asks, you have to present your case over there and your probable diagnosis and your couple of differential diagnoses. And then he or she, most important, like pointed out by Shubham and Dinesh also, that they look for any sort of miscommunication. Now, that is something that you're supposed to 100% avoid. Miscommunication now, you're supposed to, whatever they ask, they're not actually judging you on your knowledge, more so on how do you react on things. Like, are you able to understand? And also, when you don't understand, how do you react? When you don't understand, you pretend something or cook up something in your mind and say, or you say, I'm sorry, I did not understand that, or I did not. How do you reply to those things? That was there, and in the third section, I had gotten 10 entweder, like it's vice versa. Also, you get in either Fachbegriffe, or you get Patientbegriff. Like you get either patient words or you get medical words. Now you need to either convert vice versa, and then they discuss and they take 10 minutes or something, and then they call you in and give you your result. So that was my FSP. And then I had 2021 in March, I had gotten my KP appointment, which was again in Freiburg, which was, I had 3 doctors, like one orthopedic doctor, one pharmacologist, and one hematologist. These 3 were my commission doctors, and the exam started like around 12 o'clock or 11:45 or something, and ended up at 7 o'clock. There were 3 main sections. First was, again, they leave you in a room, they give like 2 to 3 hours where you have like a complete bunch of documents from Freiburg Uni, from any patient, like XYZ history hoti hai. What I got was, it was the patient with Adipositas Eingriffe, sleeve and Magen bypass, and She had lung cancer as well, and she had actually come for this time. She had only come for a Phillips controller. It was like a follow-up checkup, and you take those things and you write an epicreaser, like a short documentation of whatever you have accumulated, whatever data you have taken from history, and whatever lab values that you have been provided with. And you write a short summary on it, and that is the first one. And the second tile is again one after the other. You go in and you have like a dummy. That dummy had gynecomastia. And the question was like, for example, what was the medications that was listed? One was spironolactone. So the nebenwirkung von spironolactone is that. Such questions, and ECG electrodes placed करने के लिए, and how do you auscultation, general and physical examination वाले. And then they had again moved on to patient presentation. Whatever data you had accumulated in the first section, that you're supposed to now in your own words and in easy words you're supposed to express it. That was the second one in total. And the third one was complete in detail, one after the other. All of the three doctors in the commission, they ask you about your XYZ, whatever they feel like. They give you photos, some give you lab values. I'd gotten both photos as well, and one had given X-ray from one fracture, and one had given PFVK, vascular injuries disease picture-wise. जैसे आपको diabetes और आपका differential diagnosis would be PFVK, arterial diseases and things like that. And one had given ECG and lab values. So उस पे based on you had to answer one after the other, and it had like around 15 minutes each. 10 to 15, not 15 exactly, 10 to 15, depending on how you answer.
Nice.
And in the end.
That's great. And I mean, it sounds so scary and intimidating that it is intimidating. But then once you prepare well for a few months, then I mean, it is doable. Right? It is doable. Here, I would request all three of you to make a source of your study material, that what you have studied, like means the name of the books and all, so that we can put those in our description section of this video, so that the candidates who watch this video are interested to learn would know that, okay, what is the actual trend, what books they're learning, which books they should read from. All right, so I would request you to please send me that later on, then I will post it in the description, and the candidates can like go through them if they wish to. All right, so this was a journey about, yes, Shubham, please. Yes, Shubham.
One thing I would like to, all these exams, Fachsprachprüfung or Kenntnisprüfung, they are more practical based. These are not like the exams which we prepare, and I'm talking specifically about Indian students, which we are in the habit of preparing. Describe this, what is morbus Crohn or what is colitis ulcerosa. These exams are not, nobody's going to ask you what is this, what is that. They are all clinical based. You have to have a very sound understanding of the concepts, and they are going to ask, your next answer is going to be your next question. And that's how basically I had in my personal experience, I would say that. And
yes, the exams are application based. Here, not only in medicine, all other fields here, the exams and the tests that they conduct are application based. That means it does not matter if you don't know the exact definition of something, but you should be able to explain what it is in your own words if possible, and you should know the consequences of that and other things related to it. So yeah, that is true.
Basically, they give you real life situations, and and you are not supposed to make a mistake on emergency cases. As soon as you make a mistake on emergency cases, you are not going.
Yes, you're not going to pass.
Your first 10 minutes are going to decide whether you're going to pass this exam or not, because believe it or not, they make this impression in the Fachsprachprüfung, especially in first 10 minutes. The moment you open your mouth, they know that you're going to pass.
As I told you in this video, like before also I mentioned that, okay, we had this training, and if you see your old videos, that live training that was there. So there I have specifically talked about these phone calls where if somebody calls you up and say Kalium from 2,2, then you have to understand what is Kalium first of all, and sarcoma. So it has to come so for that. Okay, it is a notfall. That means you have to do. Does the patient have symptoms? How's the EKG? What has to be done?
Yeah.
So
Right.
does the patient have Sugang? So those
Yeah.
things I very well understand where you come from. What do you mean? Because those are the points where one mistake and you're gone. There was one candidate who did. I mean, there was the patient was of that. The case was about Pia Fauca, I think, and the question was about how much do you smoke. That there was one case where the the patient had said like one Shaktil Protag, and the candidate understood one cigarette Protag. Okay, and then he mentioned in the exam as a history that okay, patient smokes one cigarette per day. So that was the reason why he failed the exam, because he could not understand the pack years concept there. Okay, then there was another where there was a unterarm fracture and that the duration, like.
I would like to add something to that.
Yes, please, Dinesh.
See, I spent quite a few months preparing for the exam. And I always wished that there was somebody who could tell me these tiny bits. Like, just like you said, the idea of shakti and idea of cigarette was not represented to me by anybody. But by the time I started working in the hospital itself, it was clear that I need to know this.
Yeah.
Had I been contacted or communicated with such information by somebody who's experienced, that would have made my life so much easier.
The reason is that, see, thing, I understand totally where you come from. Okay. Thing is that the language, the courses, as we say, medical German, when it becomes language course, then it is taught by language teachers. Okay. Now, from language teachers, they are good teachers. They can work very well with Aussprache, they can work very well with grammar and everything. But when it is medicinal things, I mean, it's not their fault. I mean, they are not trained for that, right? And the doctors who are
Yeah,
there, they don't have that much time to like conduct courses and everything, right? So that is why we have this online course. That, okay, even though it's not personally training, we have videos. Okay, go through that and prepare for the exam. So, okay, so this was about the exams and everything. So now we talked all about serious stuff. Now tell me, what have been your experiences one by one? We'll start with